The pediatric branch of nursing is dedicated to patients ages ranging from infancy to young adulthood. In this branch, the nurses work close with the family doctor, pediatricians, and other nurses. Some of the responsibilities of a pediatric nurse are to treat common illnesses like chickenpox and other illnesses that target younger children. Since you are caring for children, you have to work very closely with the parents and families. It is your duty to teach these families how to prevent childhood diseases and what to do to promote healthy development.
Hi Stella, I'm Nurse Rebekah. I'm just going to be taking your height and weight to see how much you've grown since your last checkup.
Nurse Rebekah, how did you become a nurse?
Well, first I had to graduate from 8th grade, then high school, then I went to college, and it took me about 2 to 3 years to get my associate's degree, then another year after that to get my bachelor's degree. But throughout my time in college, I also had to study and work inside a hospital setting so that I could get real face-to-face experience with what type of things I'd be doing as a nurse. Nursing school was quite challenging for me, but in the end, it was all worth it.
What's a degree?
A degree is an award you get from your school, which says you finished a course of classes. So it's like when you graduated from preschool to kindergarten. They gave you a certificate that congratulated you for your hard work.
Is that everything you have to do to become a nurse then?
Well, not quite yet. After being educated at school, you just have to take a certified pediatric nurse exam that covers different assessments such as physical, psychosocial, health promotion illness, chronic care, and professional roles. These terms are a bit out of your league, but it pretty much means that you have to take a test that makes sure that you're ready to be a nurse. They have to make sure people like us can take good care of kids like you.
Hi Stella, I'm Nurse Kristine. I'm going to be taking your respiration rate, so can you breathe in for me?
This is so boring. Are you bored too? What's so great about being a nurse?
Well, there's so many good things about being a pediatric nurse. For one, you get to help everyone who needs help. And you always want to help people out, don't you? With a team of other nurses, you get to help kids restore their health. It's teamwork. When you do things for other people, you feel happy and accomplished. We can even choose to pick where we work.
Oh, we have a nurse at school. Are you talking about like that?
Yeah, just like that. Us pediatric nurses can be found in so many places, like here in the hospital or your school, and even in doctors' offices. It just depends on what type of nursing they do. Nurses can find work anywhere because everybody needs them. Working with you kids is probably the best part though. Sometimes working with adults can get really stressful and boring. Working with you kids is always fun because we get to give you lollipops at the end.
Yay, lollipops!
Hi Stella, I'm Nurse Nicollette and I will be taking your blood pressure for today.
Nurse Nicollette, I have a question. Is being a pediatric nurse a tough job?
Being a pediatric nurse isn't always the easiest job. Sometimes nurses have a hard time communicating with different children because usually they are scared or frightened to be here, which makes it hard for them to tell me how they feel. Sometimes kids can be resistant and might not want to cooperate with me because they are scared that what I'm going to do will hurt them. I get sad and feel guilty when I have to force them to do what I need them to do. It can also be emotionally stressful when I see patients in pain, especially when I become super duper close to them. Another difficulty I sometimes face is with the patient's mommies and daddies or other family members.
But usually mommies and daddies are nice.
Yeah, they usually are. But when their children are sick or need to be healed, they can feel stressed and hopeless. Even though they can be angry at the situation they're in, they can take their anger and frustration out on me. Parents are so used to protecting and taking care of their own children that it's hard for them to trust me to help take care of them.
Oh, okay. So being a pediatric nurse isn't always easy, but like Nurse Kristine explained earlier, it's super rewarding.
Yes, exactly.
I'm getting so bored. Is it always boring here? Is that all you could do as a nurse?
No, silly. There are so many things you can do as a pediatric nurse.
Like what?
Okay, so there's 6 different branches of pediatric nursing. There's neonatology, pediatric geneticist, developmental behavioral pediatrics, pediatric pulmonology, pediatric neurology, and pediatric oncology.
What did you just say? I have no idea what you just said or what any of those words mean.
Okay. Well, neonatology focuses on newborn infants in particular.
Oh, like little tiny babies?
Yeah, so pediatric geneticists specialize in pediatrics and genetics, so they deal with like DNA and everything else. Developmental behavior pediatrics deals with disorders and like if a child has a hard time with things like speaking or learning or even motor skills. And pediatric pulmonology has to do with a child breathing.
Oh,
and
like coughing and asthma? Because I have asthma.
Exactly. Okay, so the last branch is called pediatric neurology and oncology. Neurology deals with problems in the nervous system, while oncology deals with the treatment of blood diseases or cancers.
Oh man, that's kind of scary.
It can be, but don't worry, we have plenty of nurses to take care of you.
Mom, I learned so much when you were gone.
Oh, really, honey? And what is that you learned?
I learned that there are nurses just for little kids like me, and there's a lot of them.
Really? How much?
Nurse Mariah said there are 6 different kinds.
Does this mean you want to be a nurse when you grow up?
Yeah, Nurse Kristine made it sound so fun. She told what she does during the day, and I really want to help kids when I grow up.
Being a nurse is quite difficult, hon. Are you sure you want to be one?
Yeah, Nurse Nicollette told me there's hard things she has to go through, and I think I could handle it. And Nurse Rebekah said that the schooling was very challenging, but she said it was really worth it.
That's great, Stella. Go and thank the nurses for helping you out.
Thank you, Nurse Rebekah, Nurse Mariah, Nurse Nicollette, and Nurse Kristine. I hope I see you guys next time.